In this video, we're going to run through some basic surface anatomy. Using the pointer, here you can see the mastoid process. Above it is the squamous part of temporal bone. And here you can see the ear canal with the eardrum medially. This is the spine of Henle. And this is the tympanic part or tympanic ring of temporal bone. Where the tympanic ring meets the mastoid process, we get the tympanomastoid suture line, shown here. And where it meets the squamous part of temporal bone is the tympanosquamous suture line. And these sutures can sometimes be prominent, making ear canal skin raising somewhat difficult. Here is the zygomatic root, which goes forward to form the zygomatic arch. Anterior to the ear canal, we have the temporomandibular joint, and this is at risk of iatrogenic injury, drilling through the anterior canal wall, or disease processes such as necrotizing otitis externa. You can see the proximity of the joint to the ear canal. Going to the inferior aspect now, here again is the mastoid process and the tympanic ring seen from below. Here is the insertion of the digastric muscle. Here is the pen-like styloid process, the mastoid process, and between the two, the stylomastoid foramen through which the facial nerve trunk emerges. Here we have the IJV exiting and the internal carotid entering the carotid canal. Now onto the superior aspect, and notice how thin the squamous portion of temporal bone is, and of course the brain rendered here, specifically the temporal lobe which sits just above the ear.